So without further ado, I'm going to introduce our next speaker tonight. Let me get this pulled up. Tonight we have Daniel Broussard, a registered dietitian and third-year medical student / pre-doctoral OMM fellow at Nova Southeastern University KP-Com in Tampa, Florida, who worked as a clinical dietitian in spinal cord injury at the VA prior to starting medical school. This is where she was introduced to adaptive sports and became involved in assisting the athletes with their nutrition. She is here to interview a couple of athletes to allow them to share their experience working with physiatrists and the PM&R team, both at the VA and outside the VA. Danielle, we're happy to have you tonight.
Thank you so much, Kate. And so I will introduce the two athletes that we have today or tonight on our call. So we have Eric and Steven, and Eric is a 40-year-old Army veteran who suffered a spinal cord injury when he was 21 years old, caused by a fall. His accident left him with a T10 through T12 compression fracture, Asia 6 incomplete spinal cord injury. He has spent several years being a peer mentor to other veterans with spinal cord injuries and is currently a peer specialist for the Paralyzed Veterans Association, or the PVA. Eric is a competitive hand cyclist and para-triathlete. He competes with the PVA racing team and internationally for the US development team. For leisure, he enjoys playing tennis and lacrosse, which he feels is a great way to integrate disabled people into the community. Steven Zaravel is 33 years old, and he suffered a spinal cord injury in December 2009 from a car accident. This accident left him with a C6 through 7 Asia 8 complete spinal cord injury. He is considered high functioning in that he lives more independently than most quadriplegics, so much that most people think he's a paraplegic when they meet him. He is one of the chief engineers at Top End, a developer and seller of wheelchairs for recreational fitness and competition here in Florida. He enjoys playing rugby and is currently a Team USA cyclist for the H2 class. Thank you both so much for being here, and I especially thank you for tonight. We are on the verge of getting a hurricane here in Tampa, and so I just want to give you guys a special thank you for making it on the call tonight.
No problem.
Eric and Steven, I'm going to ask you some questions, and Eric, I'll have you answer first, and then Steven, you'll answer the same question. So it's very much an interview style for tonight. So my first question, Eric, is can you both please tell us a bit about what it was like for you during the first couple of weeks and months post-injury and your experience with your physiatrist at that time and the rest of the rehab team?
Yeah, I guess for me as a new injury, your experience is, especially at the age I was at, I don't think the severity of it really sets in right away. And I guess shock is the experience you have. Physically, my trauma wasn't so severe, and I guess depending on what aspect you're looking for, yeah, you're just in shock for the first month of it, and it's more of a just routine you follow that the doctors tell you to do, physical therapy and different rehabilitation appointments per day. So it really doesn't set in right away your first couple weeks. So it's almost a denial thing you have going on. You're just like, well, I'm just in the hospital and I'll be out here, and you really don't realize what a change of life it's going to be for you.
Thank you, Eric. Is there anything with that? Is there anything that the rehab team or the physiatrist that worked with you post injuries specifically stuck out in your mind?
Yes, especially in the spinal cord injury world. A lot of it was basically more your physical. The things that stick out in my mind that from memory so long ago was the physical therapy aspect of it more than anything. I think for a low para like me, that's one of the more important things, is basically learning to live in a wheelchair. And another thing was getting used to the being taught repetitively the issues with neurogenic bladder. I don't know why now, so many years later, I remember that so vividly, having to be told this is what you're going to be used to the rest of your life. Those are things that stick out. But the things that like I really remember is they kind of had to stay on me and keep me, I guess, distracted is a word you'd want to use, and kind of remind you, hey, every day. I noticed they kept, at least I can speak from the VA system, they kept you really busy. And now that I look back at it, like every day they were like, we need you at physical therapy at 8 o'clock, and at KT at 9:30, and at OT at 10:30, and then you can go to lunch, and then after that. And now that I look back, I kind of feel like that was kind of the team helping you get through it a little bit by not giving you so much time to focus when you were ready to be up. And of course, at first I was on bed rest the first week to 2 weeks until the surgeons say, yes, he's stable enough to be up, because I had Harrington rods in place from the T6 to the T12 in my vertebrae. So, but after I was stable and cleared, then yeah, I felt like they did a good job of keeping me pretty busy.
Thank you for sharing.
Yeah,
And Stephen, do you want me to repeat the question, or do you have a?
I think I remember. But if I start to go off track, just let me know. So yeah, the first few weeks after my accident, yeah, I think for me being a higher level injury, because like my hand function, I had almost no hand function initially, like brushing my teeth and doing the most basic things were very hard for me, if not impossible. So I think the first few weeks, what my mind was wrapped around a lot of things of like the girl I was dating at the time, how do I hold her hand, or how do I brush my teeth, or how do I like use a phone, those types of things. And then you start to kind of settle in, like you can sit up, for me, like sitting up for an extended period of time. You know, those really small goals were what the first several weeks were focused on. So yeah, and then, you know, over time, I think as a higher level injury, as you start to transition more into what Eric was talking about, where you're able to like start to work out and do some of those other things that are more like normal to your previous day-to-day life. You know, those come much later on. So a lot of small things initially, small goals of just day-to-day living. Where I have memories of like somebody having a really large impact in my recovery, probably has to do with my OT. Everybody was super helpful for me across the board at where I was at in the Metro Hospital in Cleveland. But my OT was really willing to just adapt to different strategies that I was after. So like I let her know early on, I don't want to use any adaptations. I want to try to do as much as I can on my own in case I'm like out in the wild in the world and I don't have those things. So yeah, she was the biggest impact for me.
Awesome. Thank you for sharing your answer as well. And so my second question I have for both of you is, you both are very involved in adaptive sports. Can you tell us briefly what adaptive sports have done for you in your life, or what drew you to being involved in the sports you participate?
Yeah, for me, adaptive sports definitely came later. And I actually would say that I used adaptive sports for almost more my mental health before I did my physical health. And I suffered from opiate addiction due to my injury, and which I guess I feel in spinal cord injury, the mental health aspect of it isn't really addressed very much, because I think people just assume that just goes hand in hand with your disability. But when I got into recovery, I found adaptive sports, and then that also kind of branched out into, I realized that it helped me lead just a way better life when it came to also being a person with a disability. I found it made me want to take care of myself physically better than I was before I was in adaptive sports, where it used to just be maintaining my injury and then living with it. And then after adaptive sports and after finding it, which I had a really good rec therapist that got me into adaptive sports. After finding that, it got to be, well, I want to try to be a healthy, functioning human being, not just focusing on my disability, but as an basically making me feel like like we say, a quote, a normal person again, even though I am a normal person, but as somebody like I could ambulate. So that's adaptive sports really kind of also gave me like a small society inside of a society to belong to. And it's been really good for like my camaraderie with my other spinal cord injuries and other people with disabilities. And it's helped me really feel like a productive person again. So
Thank you. Thank you for sharing that part about your story. I think that's really important to share. So thank you.
Yeah, no problem.
Stephen?
So yeah, adaptive sports, and it was how they impacted me, or I'm sorry, I got caught up in
Oh,
Eric's
that's okay.
listening.
Can you tell us briefly what adaptive sports has done for you in your life and what drew you to being involved in the sports you participate?
Yeah, so adaptive sports for me, I was somebody who was always very physically active before my injury. So it was within a year that I found year after my injury that I found a hand cycle and did a marathon and continued to stay involved in sport. And long story short, because of getting involved in the sports, I was, to what Eric's speaking to, it did help me a lot mentally as well as physically. So I had some form of an outlet, and then I was able to meet who is the person who is now my boss. And yeah, it's brought me a handful of connections that I never would have made had I not gotten into the adaptive sport world. And then it also has given me something as a hobby and as, you know, just another significant attribute to my life that provides purpose and meaning as well. And I think a lot of that comes through the community that Eric was speaking to, where you get to meet other people, you get to learn about their lives, how they do things, you get to learn how to become more independent. And then you just find that sense of normalcy again, where it's like, yeah, I work and then I go ride and like I compete, and you know, that whole world you build around you through those adaptive sports brings, yeah, a big sense of normalcy. And then it's also obviously a really healthy outlet as well.
Thank you both for sharing. My third question is, what are the most important things physiatrists can do to improve patient experience in clinical care?
Oh, that's good. I don't know. To me, I think I would say like honesty with the patient as well, and to I've always just looked at it from the patient side. Try to encourage that patient to do the most they can with what they have, to be as independent as fully possible. I realize there's so many different injury levels depending, especially if you're just talking about spinal cord injury, or if you're going to add stroke or whatever else into it. But I would strive healthcare providers to get a person to be as independent as their disability level will allow, because and to encourage them to do the most that they can, because I feel like in the long run it helps with overall health and even your mental health. I mean, I have friends that ask me why I still even go to the grocery store and why I just don't have it delivered. And I'm like, because those simple tasks still make me feel like I'm doing things. It's like, I had a friend ask, even when I bought a new house, he was like, why don't you let me make everything automated in it so you could do it on your Wi-Fi? And I said, because if my life is too easy, then I won't burn any energy at all. I was like, it's the basic things that I still can do, even whether that's just rolling over to my thermostat or doing my own dishes. Those things still make me feel like I'm a functioning human being. And I mean, and then I have some friends that have such severe disabilities that they look at me like, wow, I wish I could wash my dishes. Or I have a good friend who's an IED survivor who's legally blind, and to him, and he's in a wheelchair, and to him driving is such a big deal. And I take it for such granted. So I would say, as healthcare providers, encourage people to live the most independent they can with what abilities they have. So to basically use it or lose it kind of thing.
Mhm.
Yeah,
Yeah,
I think, sorry, Stephen.
no, go ahead.
Just to just to touch on that from being a part of the team, I think that it's easy to get into that aspect of like almost feeling bad for the patient, right? And so you want to do things for them. But I think, like you said, Eric, that's really important for us as providers to understand that it is very important to you guys that we encourage you to do the most that you can with what you have. And Stephen, do you want me to reread the question?
No, you're okay. Thank you though.
Okay.
Eric introduced me to your friend who would automate things. I'll take his number. No, I'm just kidding.
You know
Um,
him.
Yeah. No, I honestly, I agree with everything that Eric is saying, and that's a memory that popped up during the last question. The OT who had a really strong impact in my life. Something she had said, she made the statement. She's like, "Stephen, no matter what you do, I think you'll be great at it." But with, that was kind of like a very short statement and probably the middle of a session where I was frustrated or something else. But even me, we never talked a lot about like my limitations. We always talked about solutions to what those limitations were. So just like Eric's pointing out, yeah, really, you know, empathizing with the patients, but encouraging them like to do as much as they can, just as Eric said, with what they have, because there's no sense in comparing. Like we all have different injuries and different backgrounds in life. Like I think I attribute a lot of my success to my family and my friends and my faith at the time that I was injured, where if I didn't have those three things, then I think I would have ended up in a very different place. So yeah, that encouragement from people around me just to say like, let's keep living and not worry about what you can or can't do now. So.
Great. Thank you both for sharing. And this question may be pretty similar to the last one, but I guess this is more individual. So if there was one thing that you wish you could go back now and tell your physiatrist who cared for you initially after your injury, what would you say?
For me, it would be to get engaged and to get active in some community, whether that be, as a veteran going to like vocational rehab and learning a new trade, because I was unfortunate enough to not have a lot of further education. I went right into the Army after school, and I always thought that's just what I'll do. And I liked the Army. And then when I got hurt, I was like, wow, now I have nothing. And when I got into kind of a depression mode, I kind of pushed away the spinal cord injury community and the adaptive sports community and was like, no, I kind of thought I was too cool for school and didn't want anything to do with that, because I think it reminded me of my disability and being in a wheelchair at such a young age. And if I could go back and be encouraged to do anything else, it would be to stress the importance of staying engaged in whatever community is that community for you. Find your thing, whether your thing is sports or whether your thing is just reading or writing or going back to school or whatever. I think I noticed in my experience with rehabilitation medicine, especially in the spinal cord injury world, the sooner the person with the injury gets engaged with regular life schedules, the better they do. I think if they take longer to, go through all the grief steps and they get locked in a depression and it takes years to fix, it takes them longer to get engaged and get back to being like a productive, normal person, or feeling like they're being productive and feeling like they want to heal, not just physically, but emotionally and mentally. So, yeah, I think if I could go back, I would stress that, hey, engage in something. So whether that be, getting into adaptive sports or basically keeping your mind busy faster and getting me going faster with physical rehabilitation as well.
Thank you.
Yep.
And Stephen?
I think maybe part of this is like the difference in just where Eric and I were at in life. But when you asked the question, the first thing that popped into my mind was just to be told, like, be patient. And I think when I was getting reintroduced to normal day-to-day life, I was very like, a hard thing for me was just not getting up to speed quick enough with what I wanted to do. So like being able to go back to school quicker or be independent for longer periods of time throughout the day initially. So there was just a lot of, I think, added stress and not really realizing like how long the path was going to take to travel. So yeah, again, it might be just that I was in a different time period of life than Eric was, but for me in particular, it's just like be patient, like stay consistent and continue to go after small goals so that you don't get overwhelmed.
Great, thank you. I appreciate both of your answers and the difference in the answers. I really appreciate that. And at this time, I just want to open it up to anybody who is on the call tonight. And if you guys have any questions for Eric or Stephen, they're pretty much an open book. So I think you can pretty much ask them anything you have questions about.
Hi, Eric. Thanks for speaking tonight. I was wondering if you could talk a bit about what it was like going through this whole process through the VA versus maybe what you've heard from others outside of the VA and how that's different from a patient's perspective.
Yeah, I know the nice thing what I do know about the VA is since it's not a like for-profit hospital or it, and I know they operate on an entirely different budget. The VA they can afford to focus a lot more on aftercare as well. Like our rec therapists will send me emails, even still to this day. And I've been injured 27 years this month. And I'll get emails that, hey, we're doing cycling or tennis if you want to go to here or there, or there's this class on this. And they still, if I need mental health treatment of any kind, it's always there. And also, while I was in spinal cord rehab, they would take us on outings. They'd be like, oh, anybody want to? I did mine in San Diego, and who wants to go to the Chargers game on Saturday night, which was really weird because you'd see a bunch of guys with halos and Kydex jackets and stuff rolling through the stadium. And I'm sure we looked like a sight, but it got you out of the hospital, and, the nurses liked it because one of them got to volunteer to go with us, or, and we'd go like on the weekend, as long as you were cleared by the doctor and you were in that phase of your treatment, you could go on an outing on Saturdays or whatnot. And I just noticed the aftercare aspect. And I also noticed an equipment aspect. Like I have friends who use private insurance and or like Medicaid or Medicare, and they get one wheelchair every 5 years, where I get 2 wheelchairs whenever I break them, which is quite often. I'm rough on wheelchairs. And so to me, that was the standard. And same with cushions. Cushions like Rojos and whatnot are expensive, but they're also a lifesaver. People don't realize, I'm sure you guys will learn pressure sores, or, as the students, and most of you probably already know them. And the VA, if I call them and say, hey, I need a new cushion, there's something wrong with this, I'll get a new cushion. Where some of the private insurances and hospitals will be like, well, what's wrong with the one you got? Because they don't want to spend the money. But when you look at it and you're like, in a lot of those private insurances will do it as long as the doctor says, yes, they need it. And when you look at the problems you solve with newer equipment or, adaptive equipment in the long run, because I get newer equipment regularly, I deal with less issues. So I have noticed that on the VA side, but then on the VA side, it is a bureaucracy as well. And sometimes I'll wait a while for some things that I notice, like, even my friends in the private world, if they need a CT scan, it gets done right away or something. Where me, they're like, oh, our next available CT scan is a month and a half away or something, you know. And so there's pros and cons to both, but I would say that I feel on the VA side, they're not so much worried about time in your rehabilitation either. It's when you're ready. And I feel like I've known some friends that were non-VA that were kind of, let's get it done as fast as we can and get you home, you know. And I feel like when you're ready, especially that it's a scary step when you're leaving the hospital as a new injury. Because now you're like, well, I got to go home and do all these things with no nurses to back me up and no, like,
Yeah.
oh, I got to cook my first time in a wheelchair and I got to go to the grocery store for my first time in a wheelchair and drive and all that stuff. But uh, that was my noticeable difference of it. So.
Thank
Does
you.
anybody, oh, sorry, go ahead, Lauren.
First, thank you all both for joining us on a Monday evening. I wanted to ask if there was one thing you could change about the process and maybe what, I mean, it doesn't have to be what healthcare could have provided you, but maybe it could be in some other respect. But if there was one thing you could change after sustaining a life-altering injury that maybe could be done better, what would it be?
Either one of us to answer?
Mm.
Okay, I know for me, and this is from a young man, especially being injured at the age of 21, I felt like sexual function health, that discussion nobody wanted to have, including myself at 21 with the doctors. And because when you're at 21, you're not discussing that openly very comfortably anyway. And then later in life, you're kind of figuring that out. And they didn't really push the issue, and I really didn't ask the issue either. Now, that if I wish I could go back, because I've had relationships over the years and whatnot, and I've been married and everything, so I am divorced, and so I wish I could go back and work on relationships and maybe how I was going to handle the mental health process of it a little better.
Okay. Thank you.
Yeah, of course.
That's good. And then I also think of just like re-engaging day-to-day life. Like, I think that was probably the hardest part, because just like Eric said, for me as a civilian, you know, once I got out of the hospital, it's kind of like, okay, now live your life. And then everybody around you is like, there's some people around, I'm sure, that will have high expectations, and others that are, they won't blame you for just kind of chilling out every day and not really putting yourself to the test, you know, and trying to get back out there. So I was fortunate to have some like part-time job opportunities and things that I kind of got my feet wet with. But that there's kind of a gap in between, like, okay, you're released from the hospital, and then like, what do you do? How do you slowly ramp up to, you know, full-time job and like, yeah, learn that you can have a family and have kids and do all the normal quote unquote stuff. But that period is very gray once you're kind of cut loose, so to speak. So I don't know, you know, I don't think that's necessarily up to like the medical field, but that is a gap where you're released now and everyone's going to feel bad for you. And then like next thing you know, you're going to be 50 and you may have just wasted 30 years of your life. So yeah, it's a very gray area.
Do you think, and you can say no, but do you think some kind of informed therapist would be someone to follow with maybe every 2 weeks or something would have helped? Or I don't know if you're talking from more of a mental health perspective, or just someone to listen and talk these things through.
Honestly, I think it's probably more like voc rehab, like that aspect of where it's just showing you the small steps and then making the connection. So From my experience, and it could be totally different now, Voc Rehab was like very willing to help navigate a job position or schooling after getting to back to school or getting a job, but there wasn't really a sense of know-how in actually obtaining that position. So like I've heard of horror stories for some people of getting employment and then just low expectations for the employer and that person going to get the job. And, you know, it's kind of this awkward dance where that person's like, I want to try, but I don't really know how to, you know, prove myself. And the employer's like, so can you do this job or not? You know, there's a lot, it's just a lot of awkwardness in between that area, I think.
Okay. Thank you for the insight.
I think for the sake of everybody's time, thank you so much,